Hi, everyone. I'm going to give you a bit of an update on some of the numbers, and then I'll concentrate on a bit of a vaccine update, and I'll concentrate on some of the news that you undoubtedly have heard about the step one starting this Friday. Well, first of all, the numbers are the lowest we've had in a long time. They were up by 525 yesterday in the 600 range, so we still are seeing a very nice downhill trajectory. Provincially, Ottawa Public Health had 17. Toronto and Peel again had the most, but much lower than they were a while back. And so that is very good news. And I'm happy to share as well that with our numbers, we are basically quite low as well. Over this weekend, I think we had Saturday, Sunday, 0 cases, and over the whole weekend, we actually added 2 cases. Well, actually 3 when there was a correction in Cornwall. So, but overall, there were like 3 cases over the weekend, 0 and 0 on Saturday and Sunday. So that is very good news to us. I was looking at the confirmed cases and looking at a sort of weekly basis, and you can very clearly see, this is kind of our third wave that peaked around around the beginning to the middle of April here, and you can see how it's gone down quite nicely now in terms of the number of weekly cases that we've been getting, quite low. And again, if you look at our rolling average, we really sort of have gone a long way from this is just for May here, so you could see for simplicity's sake. But in April we were really in the 100 and something range, very, very high. You could see right now that we're 10 or less in our area right now, 9.1, 8.3. So that's clearly low yellow zone. Again, these numbers, these are no longer going to be zones anymore, but you could see this is our rate, and we want to be as low as possible to be able to continue with some of the reopenings. And again, that is to me excellent news. In terms of other parameters, there are no outbreaks at this point. We have at this point 5 hospitalized, actually 4 are in the ICU out of the 5. And we kind of see that provincially as well. We're seeing that virtually there are almost the same number of hospitalizations as ICU. So what's happening is the individuals that are there are quite sick and are there for longer periods of time. So I was looking at the numbers. Literally, there's 500 and something admissions in the hospital to the total hospitalized individuals across the province, and almost as many in the ICU. And again, those numbers are slowly going down. But again, the ICU numbers take a long time because these individuals are sicker and are there for longer periods of time. But again, going down into the right direction, very positive in that regard. In terms of our vaccinations, I really want to spend a bit of time on that because we've had some updates and changes and some issues with people not being able to get appointments, and I'll explain that so people will understand what's going on. We have now almost 75% in terms of our numbers as of today of first doses that are. Most of these are first doses. We don't have a significant amount of second doses. I think there's like several thousand maximum out of those. And so most of these are first doses, but you can see that we're at the 74% range. And if I extend that into, by the end of this week, we'll be closer to 80% in our population first dose, which is very good. I had wanted to be about this by the end of May, so it's not too bad. Despite the lower numbers, now the numbers are going up in terms of our vaccines. So I think the numbers will just keep going up. And again, we're going to be switching to majority second doses. Now, several things have happened over the weekend. Obviously, individuals. First, let me go back to those individuals that were vaccinated in our clinics before March 15th that were vaccinated without going through the provincial system. There's about 6,000 of them. About a couple of thousand are hospital ones, but the rest are community citizens and so on. Those individuals have already we're reaching out to them, and we have already reserved their places in the clinic. So don't worry, your second doses are there, and we know when they're due and so on. So that's happening, and not to worry about that. Other individuals who got their appointments on the ministry system, there are two groups of those. Individuals who are less than 70 years of age can go online and book on an earlier system, an earlier appointment, effective today, obviously. And individuals, regardless of age, who got their vaccination before April 18th, can actually go online as well. So we had, before this announcement, we had between now and July 9th, we've had almost 43,000 spots, and we had about close to about 8,000 available as of this morning. And between 8 and noon, they were all taken, they were all booked. And so individuals who have gone online were told that there were no clinics available or some sporadic clinics available, and that's because they were all taken within the first period of time. And as you know, we're only given a heads up of really 3-4 weeks in advance. So we only had clinics in the system until the end of June, first week of July. So I want people to understand, not to worry, that we are adding more between now and the second week of June. We're adding several thousand more, and certainly as we're moving towards into June, we're actually adding at least 10 to 12,000 spots per each week as we're moving forward. So there will be there and made available as the clinics that we're adding for the second week of July, that the week right after this period, will actually be live probably the end of the week. And again, that's how the system works. We have to do it at least a month in advance, so the most a month in advance. And that's why it's not that there are no positions for you. It's not that you're not going to get an appointment. It's just that we have booked those. We have just planned those clinics based on our allocations, and we can't do it for the summer. I can tell you, just to relieve you, that between now and the second to third week of August, we will have had over 100, between now and then, at least 110 clinics, separate clinics, which we're averaging 1,000 to 1,200 a day. So if you look per clinic, you're looking at another 120, 130,000 spots on top of this all. So we will have vaccine. We will have vaccine for second dose. And again, I'd like very much to just reassure everybody on that. And so those, what you've been seeing in terms of it wasn't that those clinics that were available, there were between 7,000 and 8,000 this morning, between 8 and noon, and they were all booked. Again, that was because they made an announcement and everybody it opened those. So again, it always happens when there's an announcement made and a lot of people call. And as a matter of fact, the call center was actually overwhelmed as well. At one point, they had 10,000 calls at once. So again, please be patient. Please don't worry. We will be getting a second dose. I and our health unit staff wants nothing more than to vaccinate your second dose as quickly as possible. And again, we're just waiting on those numbers. And I do anticipate more vaccine coming in and much more. And if we need to, we'll ramp up our clinics as well to be able to accommodate that. I just wanted to also let you know that we are also on the side, on top of what we're doing now, providing vaccine to primary care doctors, but also to pharmacists. Pharmacists are getting it separately, and they're getting about 4,000 doses a week. Half are Moderna, half are Pfizer. So please, if look at your local pharmacy, there's about over 40 of them in our area that have it. So if you can call your local pharmacy as well, if you're very worried, you can be able to get your dose there as well. What our goal is to have multiple places where people can get their vaccines. And so again, that's why as we roll this thing out, there'll be much more availability and much more possibilities for people to get their second doses. I'm actually very happy that people want to get their second doses, because in other parts of the world, like the United States, for some reason, people don't want to get their second dose. They get their first, they think it's enough. Well, it's not enough. It's actually enough for the first dose can protect us from most things, not 100%, not as optimally as 2 doses. It will not protect us as much as we'd like to against the Delta variant, which is the Indian variant, which we know you only get protection 30-40%, although it can protect prevent a lot of admissions and hospitalizations and so on. But again, that's why we're anxious to be able to go to those second doses as well. So that's that with vaccines. Again, good news on that front. The other thing that I wanted to just very quickly go over with you as well is just to share with you that obviously there's going to be the reopening right now. As you know, it was announced today. Step 1 will start this Friday at midnight into June 11th. You can see here 12:01 a.m. And I'm just going to give you some very high level sort of summary of that. Obviously, we're at 60%. We're actually close to 80%, as you know, by the end of this week, and so we're pretty good. We're going to be looking at 20% fully vaccinated. I think it's very realistic over the next couple of weeks for us to do that. But again, I'm just going to give sort of a high level of what can reopen in step 1. Again, it's more outdoor activities and well-managed crowds. So outdoor gatherings of maximum of 10 people, outdoor dining in restaurants, 4 people per table, outdoor fitness classes, no games or practices, but sports teams can practice together. Essential retail capacity is going to go up to 25% to sell everything. Non-essential retail is going to be able to open at 15% capacity to sell everything. Retail stores in malls, unfortunately, will not be able to open unless there is a street-facing entrance. Indoor religious services at 15% capacity. Outdoor religious services, again, it's physical distance permitting how many can go. Horse racing, motor speedways can occur, but no spectators. Pools, outdoor pools, wading pools, and so on are going to open. Outdoor zoos, landmarks, historic sites, botanical gardens, those things that are ticketed but very controlled with 15%. Day camps will open. Campsites, campgrounds, and short-term rentals, as will overnight camping at Ontario parks. We were also told that today we asked in beaches. Well, beaches have particularly always been open, but they'll be open as well, obviously. And so that's where we are with that. There is sort of a sector by sector description of when and what can occur. And so we've gone over this. It's on the website. We're awaiting the specific regulations, but these are, in my mind, a very good foray into starting to open up slowly, and it will give us time to do that. So I just want to stress that this is kind of a very important time that we continue adhering to those numbers, to those measures, continue respecting those gathering limits and so on, because we want to go slow. We want to go slow. And, if you look at step 1, step 2, step 3, and beyond, particularly when we have, 80% or 75% at least of the population 2-dose vaccinated, you're looking at, big time openings and those type of things. Not 100% normal, but certainly much, much normal than we've seen in a while. So that's very important that we keep that in mind and have that in the back of our mind, that the variant can throw a kink in this as well. But I really think that as we continue with our with vaccination rates going up, particularly second dose, and if we adhere, respect, those measures and slowly reopen, I think we'll bypass any negative effect of any potential negative effect of that Delta variant. Bonjour tout le monde, je vais commencer avec les chiffres. Je vais aussi donner un sommaire au niveau où on est rendu avec nos vaccins, et finalement, je vais finir avec la réouverture. Comme vous savez, bien sûr, vendredi qui vient, on va commencer avec l'étape 1 de réouverture de tous les commerces, etc. Je vais parler tantôt, mais maintenant, je veux juste donner les chiffres qu'on avait aujourd'hui. 525, c'est l'augmentation qu'on a eue depuis les jours précédents. Ottawa avait 17 et Toronto et Peel aussi la plupart, mais encore beaucoup plus bas qu'avant. C'est la même chose dans notre région. Ça va très bien dans notre région. Je vais juste changer ici. En effet, qu'est-ce qu'on voit? Que nous avons maintenant 95 cas actifs. C'est beaucoup moins qu'on avait. On a 5 à l'hôpital, 4 donc en soins intensifs. On voit la même chose à travers l'Ontario. On a à peu près 580 cas admis avec 500 aux soins intensifs. Donc ça veut dire que les personnes qui sont admises prennent du temps. Sont beaucoup plus malades qui sont admis, sont en effet plus jeunes aussi. C'est pour ça qu'on voit la différence. Mais par contre, les chiffres sont beaucoup plus bas dans notre région et aussi à travers l'Ontario. Nous voyons ici que au niveau des changements, cette fin de semaine, cette fin de semaine, nous avons ajouté actuellement, samedi et dimanche, aucun cas. Donc, les 3 cas que nous avons, eux, c'était vendredi seulement. En effet, c'était aucun cas à Cornwall. On a enlevé une, c'était à cause du changement technique du ministère, mais comme vous voyez, à peine qu'on a eu quelques cas. Ça c'est sur 3 jours, là, vendredi, samedi et dimanche. Donc, ça, c'est une très bonne nouvelle. Et aussi, je vais juste vous montrer ici que quand on voit au niveau des cas dans notre région par semaine, vous voyez vraiment que le vague ici, le troisième vague ici, on voit ça qu'avec le maximum, c'est à peu près la première semaine ou deuxième semaine d'avril. Et vous voyez doucement, doucement, on va vers la fin de notre courbe ou de notre vague dans notre région. Donc, ça, c'est une très bonne nouvelle. Et au niveau des moyennes mobiles, vous voyez nettement qu'on est vraiment en bas de le 10, qui est très bon. Donc, ça, c'est les chiffres qu'on voudrait maintenir et aller plus bas. Donc, ça, c'est très bon dans notre région. Au niveau, donc, il faut continuer avec tout ça. Je vais parler encore plus tard pour les réouvertures, etc. Mais là, je vais vous parler un petit peu des vaccins. Voilà, vous voyez, on est presque à 75% de la population vaccinée, première dose dans notre région. À peine 2 000 à 3 000 avec deuxième dose, mais la plupart sont première dose. Et si je calcule bien, d'ici la fin de semaine, on va être rendu à presque 78-79%. On approcherait le 80%, qui est très bonne dans mon avis. Donc, ça, c'était une très bonne nouvelle au niveau des vaccins. Et puis, je vais juste parler un peu au niveau des vaccins, des nouveautés qui sont arrivées, les nouvelles choses qui sont arrivées. Pendant la fin de semaine, on a annoncé, comme vous savez, que les personnes qui ont eu leur rendez-vous sur le site web du ministère. Les personnes qui ont été vaccinées après le 18 mars, à ce moment-là, ces personnes-là ont eu deux rendez-vous pour la première dose, et un autre 4 mois après pour la deuxième dose. Les personnes qui tombent dans cette catégorie, les personnes qui sont en bas de 70 ans ou qui ont eu leur vaccin, la première dose, avant le 18 avril, dorénavant, pourront aller sur le site web et reprendre un nouveau rendez-vous plus proche pour avancer leur deuxième dose. Malheureusement, ceci est annoncé hier et dès 8 heures du matin, malgré que nous avons eu presque 8000 places de libre, ils étaient toutes bookées entre 8 heures du matin et midi. Donc, il y a des personnes qui ils sont découragées parce qu'on n'a pas d'autres cliniques. Découragez-vous pas, ça arrive tout le temps. Nous allons ajouter quelques milles pour la semaine de juin qui vont être disponibles très bientôt sur le site web. Et aussi, on va commencer à rajouter après le premier semaine de juillet au moins 10 à 12 000 places par semaine juste dans nos cliniques de bureaux de santé de l'Est Ontario. Et nous prévoyons d'avoir d'ici là 110 cliniques dans notre région, avec au moins 1000, peut-être 1500 dans chaque clinique par jour. Donc, vous voyez le débit, on va avoir une autre capacité d'une autre 120 à 130 000 facilement pour le deuxième dose de tout le monde d'ici mi-août. Donc, inquiétez-vous pas, ça arrive parce qu'on ne peut pas on peut pas vraiment placer les places plus qu'un mois d'avance. Donc là, on va commencer à rajouter bientôt le deuxième, troisième, quatrième semaine de juillet. À chaque semaine, il va y avoir 10 à 11 000, des fois 12 000, dépendamment du débit de vaccin qu'on va recevoir, des places disponibles pour vous. Donc, inquiétez-vous pas, ce n'est pas qu'on vous a oublié ou que vous n'aurez pas votre deuxième dose, vous allez l'avoir. On va avoir en masse le vaccin pour vous. L'autre catégorie qu'on a, c'est les personnes qui ont reçu, on avait à peu près 6 000 personnes, à peu près 2 000 à 3 000 étaient des personnes qui travaillent dans les hôpitaux, les professionnels de la santé, etc. Mais ces personnes-là, on sait ils sont dus avoir leur vaccin fin juin. à ce moment-là, ou mi-juillet à peu près, on a vos chiffres. Vous avez déjà reçu un courrier électronique. Vous allez être appelé de notre bureau de santé pour que vous avez le rendez-vous. Ces 6 000 places sont réservées pour vous. Les 6 000 doses sont réservées pour vous. Donc, inquiétez-vous pas. Donc, vous allez recevoir votre dose en temps. Donc, ça va très bien. Je suis très encouragé qu'on a cette type de demande parce qu'on voit dans notre région, surtout aux États, qu'il y a des personnes qui pensent qu'une dose est assez et ne voudraient pas recevoir la deuxième dose. Mais c'est très bon pour nous. Il faut continuer d'ici là, d'ici le temps qu'on va avoir un pourcentage de la population, 75 qui ont les deux doses. Il faut vraiment, vous allez voir progressivement, on va enlever le port des masques, tout ça, une fois qu'on a un débit important de la population qui a été vaccinée 2 fois. Mais d'ici là, on porte des masques, on continue avec les précautions de santé publique. Ça, c'est très importante pour nous. Donc, ça, c'est de très bonnes nouvelles pour nous et découragez-vous pas. L'autre chose, je veux dire aussi que en plus des cliniques que je vous ai décrites tantôt, on a à peu près une quarantaine de pharmacies dans notre région qui recevront en total à peu près 4 000 doses par semaine de vaccins, moitié-moitié Pfizer, Moderna. Donc, vous pouvez aller les appeler aussi. Puis, à un moment donné, quand on aura beaucoup de vaccins, ça sera disponible partout. Donc, on aurait des choix à aller pour se faire vacciner. Et aussi, les médecins aussi en soins primaires vont avoir le vaccin. Ils ont déjà. Donc, inquiétez-vous pas, il va y avoir beaucoup de vaccins pour tout le monde pour recevoir leur deuxième dose. Et moi, je prévois que la plupart des gens qui voudront le deuxième dose vont le recevoir d'ici le troisième, quatrième semaine du mois d'août. Les chiffres sont là, la capacité est là. Je suis très confiante qu'on va y arriver. Donc, là, je vais parler maintenant, comme vous avez bien sûr entendu parler, on commence maintenant avec le déconfinement de l'Ontario qui va commencer dès le 11 juin, soit ce vendredi à minuit et 1 minute. Donc, ça, c'est des très bonnes nouvelles. Je vais juste me rassurer qu'on continue à suivre tous les normes qui sont là. En effet, je vais juste donner un petit peu de contexte ici. La première étape, c'est 60 de la population vaccinée. On est rendu beaucoup plus. Comme vous savez, on est presque à 60, on est à 75 on approche le 80 mais comme deuxième étape, il faut avoir à peu près 20 des personnes vaccinées, les adultes vaccinés avec les deux doses, et aussi de respecter les chiffres qu'on a actuellement, d'avoir un débit vraiment qui est gérable au niveau qu'on peut gérer facilement avec le débit et bien sûr continuer de diminuer l'hospitalisation, diminuer les soins intensifs, diminuer tous les cas, le débit des cas et tout ça. Je vais juste vous donner comme un peu un sommaire. Donc, ce qui peut rouvrir aux premières étapes, les rassemblements à l'extérieur sont 10 personnes maximum. On pourrait manger au restaurant, mais à l'extérieur, 4 personnes limite à la table. Et tout ça va progressivement augmenter avec la deuxième et troisième étape. Mais je vais juste parler un peu juste de la première étape ici. Donc, au niveau des conditions physiques, sport, etc., on pourrait le faire tant que ça ne soit pas plus que 10 personnes et tant qu'on ne joue pas les jeux, on peut entraîner, etc. Les détaillantes essentielles pourront augmenter leur débit de personnes dans le magasin à la fois et peut tout vendre avec 25 dans 25 de capacité. Même chose pour les détaillants qui ont des biens non essentiels. Même chose à 15 de capacité. Au niveau des centres d'achat, si ils possèdent une entrée sur la rue, ils pourraient ouvrir. Sinon, ils devraient être fermés. Au niveau des services religieux, 15 de la capacité de la salle. La course de cheval, vitesse motorisée, etc. Oui, mais sans spectateurs. Les piscines, etc., vont ouvrir. Les plages sont déjà ouvertes, donc ils vont continuer à être ouverts. Les zoos, les points d'intérêt, etc., qui ont des billets, qui est limité. On pourrait contrôler la capacité, c'est à 15%. Le camp de jour, l'emplacement du camping, les terrains du camping et location à court terme pourront recommencer, ainsi que le camping avec nuitée dans les parcs d'Ontario. Donc, on va procéder avec tout ça. Donc, ça va commencer, tout ça va commencer cette vendredi. Donc, je prévois que le deuxième étape qui va disons que tout va bien et on rentre au deuxième étape, ça va aller, je pense, le 2 juillet ou quelque chose comme ça. Donc, après ça, ça va être la troisième étape. Comme vous allez voir qu'avec toutes les étapes et avec la progression de numéro de vaccins, les chiffres de vaccins, la population vaccinée, surtout avec la deuxième dose, les restrictions vont être moins et moins. Pas tout à fait normal comme avant, mais beaucoup plus normal qu'on avait. Et le plus qu'on approche le mois de septembre, octobre, ça va être beaucoup plus normal. Ainsi aussi pour les masques, il va y avoir des différents directifs, différents règlements pour les personnes qui étaient vaccinées. Ils n'ont pas besoin d'avoir des masques quand ils vont dîner ensemble, quand ils vont se visiter, etc. Donc tout ça va venir, mais d'ici là, il faut toujours respecter les précautions, les masques, tout ça, jusqu'à nouvel ordre, mais ça s'en vient vite et ça s'en vient bien, mais encore, juste un petit peu de caution, juste, faut être sûr qu'on fait ça de façon douce, tranquillement, doucement, et de respecter les normes, de ne pas trop ouvrir trop vite, parce qu'on ne va pas reculer. On veut aller d'avance, on voudrait toujours maintenir la diminution des cas très bas dans notre région et ça va nous donner la chance d'augmenter le débit de vaccins le plus qu'on pourrait. So I'm going to answer some questions now. I got a couple of questions here about Walmart doing some fundraisers with colorings. We were not aware of it. We asked them to stop, but they had stopped anyway. So that's my answer to that. I have another question here about the booking system, and I've explained that as well. And then I have another one from Santa Freeholder. Why were the online updates changed from daily to a few days? I don't understand what the question is. We have daily updates, except we don't update it on the weekends. That's never changed. How does the present Delta variant in the region? We don't seem to have a high Delta variance in our region. Most of our variants are, as a matter of fact, we don't have that many anyway. We only had a couple of cases, but the variants seem to be the version that we can, when they test the variant, what they do is they do a screen, and the ones that they can identify are usually the UK and the other versions. The ones that they can't identify, they presume is the Delta, because they don't have a specific test for those. But we have minimum, if any, in our area, and I'd like to keep it that way. And then the final one is, what are the exact efficacy rates for vaccines against Delta variant? They're about 35 to 40% for after first dose, and 80 to 90% after second dose. And so we also have some evidence that even one dose protects you, although it's not 100%, but does protect from hospitalization and death. However, obviously, we want to give the 2 doses to not give this fast spreading, variant a chance. And that's it, Jenna. We can go to the media now with live questions.
Thank you, Dr. Paul. Merci. Our first question comes from Bill Kingston, Cornwall Newswatch. Please go ahead.
Good afternoon, Dr. Paul.
Hey, Bill.
Hi. So you said that there were about 8,000 slots available when it opened, and they were taken up between 8 a.m. and noon.
Yeah.
We have a number of people from Cornwall that went on immediately at 8 o'clock, and there was nothing there. Were most of those 8,000 spots, were they like in Prescott Russell?
No, they were everywhere. We had all our clinics. We've got clinics running everywhere. So I can't explain that, Bill. We had, I don't have it with me, but we have many more clinics in Cornwall actually than we do in Prescott Russell. So I don't know what happened there, but I can tell you that we're adding more, and we're adding more to that. And it always happens. They kind of tell us last minute. We haven't even had a chance to add those clinics. So, but that's how they work. They told us on Saturday they'll be doing this.
So you said you're going to be adding them. The provincial booking systems opened that window. How are you going about communicating that other than people having to check and go through the website process extensively every day, when just so happens they might find a Cornwall appointment?
The problem is that we can tell people that, you know what, we've submitted the clinic, but we don't know when they're going to go live, and that's our problem. So we're telling people to check every couple of days, and if there's a big change in that, we will either do a press release or we'll put it on our website. I do understand it's a bit frustrating, but it's, again, these are circumstances beyond our control. When you're told this and you have a limited vaccine that you've already booked for like a 3 to 4 week period, and then you get those extra things. We anticipated this would happen. We told the ministry this would happen, but they wanted to go ahead because they wanted to start that ball rolling for at least getting the second dose mindset going.
Hindsight, do you think you could have communicated what happened today any better? Let people know that, listen, there are no appointments available as of noon?
Hindsight, yes, but what happened was I wanted to find out what the issue was, and I just found out now. So part of it is what I'm doing now. And moving forward, I'd like to be able to be proactive about it. But on the other hand, sometimes there are glitches. I wanted to make sure it wasn't a glitch in the system versus that we've run out of places.
Okay. And just my follow-up, so it's also open for vaccinations for 12 plus.
Yeah.
And we've heard from experts that say that the biggest risk to community is people 60 plus.
Yeah.
How are you logistically handling that to make sure that you get the riskiest population vaccinated first on the back end? Because I mean, the timeline now, even kids theoretically won't be completely vaccinated by the time school starts.
Yes, they will. Yes, they will. We know the numbers, and we have calculated that we will at once be able to vaccinate first and second dose based on the numbers that are coming in of the 12 to 17s, many of which have already been done. But we also have appointments for them. And secondarily, we've reserved only partial spaces for them because we didn't want all our clinics to be 12 to 17. So there's plenty of vaccines. So we did the math. The ministry did the math provincially, and we did it locally, and it will work. At once, we'll be able to do the higher risk individual second dose, and at the same time do those kids as well. The kids will also be done by the 22nd of August as well. And by that time, we'll have much more vaccine and much more availability. And so we asked the same question, Bill, when they told us about this plan. They asked it to the ministry, and they did the math with us. And so this is a bit of an overlap, first, second, but I don't think it'll be much of an issue moving forward. People will be able to get their second dose. And I'm still convinced that we'll be able to get all this done between now and the end of August.
Just a quick follow-up.
Sure.
Of the kids that are getting vaccinated right now,
Yeah.
either if you can give me an idea, either as the 120 or 130,000 doses between now and the middle of August, or the 10 to 1,200 or 1,000 to 1,200 per week. Can you give me an idea of how many of those are children?
Right now, we've booked actually there's almost 5,000 booked.
5,000 booked. Okay.
Out of those. Yeah.
So that would be 5,000 out of like the 130,000 potentially?
Yeah.
Okay.
Yeah.
Perfect. Thanks.
One dose. Yeah.
For one dose. Okay.
Yeah.
Perfect. Thank you.
Thanks.
Next question, Philip Blanchard, Morrisburg Leader. Please go ahead.
Hi, Dr. Paul.
Hi, Philip.
Okay, good. You can hear me. I got a new computer, so I just want to make sure.
I hear you good. I hear you well. Don't worry.
Okay, good. So my first question kind of piggybacks off of Bill Kingston's question. There was a posting this morning on the EOHU Facebook page that the vaccine clinics for 12 to 17-year-olds, the school clinics, will have second dose dates that are in a shorter interval.
Yeah.
What about the 12 to 17-year-olds who are the first to book? Their intervals are in the 16-week range, which means end of September before they get that.
No, okay, good question, and I have the answer. We're encouraging people as much as possible, and I actually said that at my last press media conference, that we are reserving those spots for them the week of the 14th and the week of the 21st of June, because we've programmed the computer that when they get their first dose appointment, they will get the second dose appointment before the 22nd of August. That was our date. We also said that if parents, for some reason, and we've done about 800 or 900 of them already, we vaccinated. Those individuals got their appointment for 4 weeks, but we have a list. And again, we're going to go back to them and bring up their appointment.
Okay, because and full disclosure, I'm talking about my own kids in this too.
Yeah.
They
No,
were
no.
early, they were
You-
early ones, and
I
their
understand.
appointments are end of September. So
No, that will be moved
yeah.
up. Just like we moved the others that we did, we're going to move those up. We know who they are.
okay, good. So next question. Now that we're exiting the shutdown into
Mhm.
step one, can you speak to any enforcement issues during this last shutdown period, specifically in South Dundas? Have there been any businesses that have been fined
No,
for not complying?
no. We had a couple of businesses that were, they were actually more in Prescott Russell that had issues, but not in Dundas.
Okay. The uptake in vaccinations, based off just you talking and from talking to people in the community, there's a clamor for vaccine appointments, which would mean that there is less vaccine hesitancy. How would you characterize that now that we're about 6 months into having vaccine availability, specifically about younger populations?
Well, you know what? In all fairness, most of the people that have been vaccinated, and if you look at the percentages, they're more the elderly. But I'm still seeing, and it's anecdotal, but we're still seeing a significant amount of people coming, less than 40, less than 50. So at this point, if you're looking at our total population, okay, we're looking at about 167,000 18 plus, and we've done about 124,000 of them.
Okay.
Right. So, which is pretty good, So we're always going to end up with some kind of a resistance. I do anticipate that, the vaccine rates will drop with age, but I don't think that it'll be as significant as perhaps we had worried about. But on the other hand, we'll wait and see.
Okay. I'm assuming that you did not really agree with students not returning to class before the end of the school year because you were recommending this.
Yeah.
But what is your take on Premier Ford saying that it's okay to have some sort of an outdoor gathering for the end of the school year, considering that step 2 won't even start until at least July 2nd?
He took us all by surprise, took me by surprise, took my colleagues by surprise, took school boards by surprise. Very difficult to manage. The schools called us, the school boards had no idea. They're trying to manage something. I think it's difficult to do. And I don't know that they'll be able to manage it that way. And I know the school boards already have said they can't do it.
Right. Okay. And just lastly, there's a clarification, if you wouldn't mind, from today's announcement. It says that for patios, it's 4 people per table.
Yeah.
Does that mean 4 people from the same family or 4 people from different households eating together?
Let me tell you. We requested that it would be specific from household members together, but it's very difficult for them to regulate and to have it monitored. And so at this point, it's left open. There's no specific restriction. Logically, I'm asking people to go family at a time. Some health units are actually going to order it, put as a Section 22. We've done too many of those. I'm hoping that the people realize that you should go out with your family, and it won't be long between you. At least as a start.
And if your household happens to have more than 4 people,
then it's fine. That's an exception.
Okay. All right. Thank you.
No problem.
Next question, James Morgan, The Review. Please go ahead.
Hello, I hope you can hear me.
I can hear you well.
Good, okay. I was wondering if today's announcement has any effect on the boundary checkpoints entering Ontario.
Good point. The boundary checkpoints are still blocked until June 16th.
Okay, good to know. Thank you.
Yeah.
Do those joining by phone have questions? Press *6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you very much, everyone. Merci.